on mine, but it does. It's so nice to see, actually.
Great to be with you today.
Hi, Dina. Dina, how are you?
Good, good. Hope you're doing well.
Thank you. We're okay. I think this is the first call where we don't have any discussions, at least on the agenda, planned around restructuring and humanitarian resets and UNAT and all of that. So in a way, that's positive. We can always answer questions at the end, but it feels good to actually focus on the achievements of everyone instead of the structures. So one more minute, just so to make sure that everyone is here when we start the presentations. Okay. So welcome, everyone. You are here with me today, Astrid, because Jennifer is in a policy dialogue on Islamic, how do you call it? Suddenly I lost the word, philanthropy, and how to work on Islamic philanthropy and making it work for displaced women and girls. That's in Geneva today. So she's there. That's at the ICRC, so one of our core members as well. Today, we're going to present Oswald's mission to Burkina Faso, and then we will have Caroline and Dina presenting on the Technology and Innovation Reference Group. And then we will go into funding, a new report on funding and making partnerships work in Yemen by IRC. And then we will have some updates on the 16 days and the GPC forum with Shiva at the end. So maybe let's get started to make sure that we get through and we don't run over time. Some of you, for some of you, it might be your morning if you're in Latin America and the US and you have meetings afterwards, and others might have other things they want to do after work. So let's dive into it. Oswald, I saw you're online. So Oswald just came back from a support mission to Burkina Faso. He has 2 more missions planned kind of within the same project in this quarter of trainings and technical capacity building. Are you there, Oswald? If you're speaking, you're muted.
Yeah, yes, Astrid. Hi, Astrid. Hi, everyone.
Hi, Oswald. So it would be great if you could actually present kind of the mission, what came out of it, what the plans are for your region on the rosters of experts. So over to you.
Oh, thank you, Astrid. I've been asked by the global GBV AoR to brief you on my recent mission in Burkina Faso. I can see that Liliane, the GBV AoR coordinator from Cameroon, is also connected. So Liliane, please feel free to add something if you want, as we were together on mission. Before, I would like to first give you a background on the creation of the national rosters of GBV in emergencies specialists and humanitarian midwives in the West Central African region. You know the context. The West and Central African region continues to face frequent crises caused by several factors, including terrorism, climate change, and others. And these crises strongly described essential health and protection systems, putting millions of women and girls at great risk of maternal death and GBV, while also limiting their access to life-saving GBV and sexual and reproductive health services during emergencies. We think that one important solution is to strengthen national capacity, ensuring that trained national experts are ready to respond quickly at the start of any crisis. This can build and maintain a local capacity to deliver fast, more effective, and context-specific humanitarian responses. And
Oswald?
this also,
yeah, sorry to interrupt you, Oswald. Are you able to put on your camera, or maybe not because of the internet capacity? I just thought if you're able to, it's always nice to see your face while you're speaking.
Yeah, but I'm not sure with my internet capacity. Yeah, that's why I'm not.
Well, nice to see you.
I don't trust my internet capacity. So let me keep off my camera. And sorry for that. So, as I was saying, can also support the preparedness, national ownership, and interagency collaboration and long-term sustainability. So in 2023 and 2024, the UNFPA Regional Office for the Western Central African region organized 2 humanitarian leadership programs, HRP. And this led to the creation of a regional humanitarian roadmap involving also the REGA team. And a key part of this roadmap is to invest in the capacity of midwives and GBV specialists for humanitarian response. And through this, UNFPA aimed to help strengthen national system and ensure that even during emergencies, women and girls can continue to access care and protection from qualified professionals. During this year, in 2025, 5 national rosters are planned to be set up. We have started in Côte d'Ivoire in March, and then in Burkina Faso in October, Benin, Mali, and Togo in November. So, as I introduced this presentation, I said that I've been asked to brief you on my recent mission in Burkina Faso. And this took place in this October 13 to 17 to support the establishment of a national roster of GBV specialists. While UNFPA is taking the lead in establishing these rosters, as this clause is closely linked to its mandate, the training and management of established rosters are not UNFPA's alone responsibility. As you can see in the facilitator team, we have regional staff, including me, the REGA team leader. We have the regional GBV emergency specialist for UNFPA. We also have the UNFPA regional advisor, Karen. At country level, we also invite to support based on their experience some GBV AoR coordinators. Example, For the training in Burkina Faso, I was there with Liliane Munezero. She is connected. She is a GBV AoR coordinator in Cameroon. And we will have the GBV AoR coordinator for Burkina Faso to support the Togo training. And the GBV AoR in Niger will also support the training in Mali. So other interagency partners are also involved, like OCHA, for example. OCHA presented the session on humanitarian principles in Burkina Faso. We have also GBV AoR colleagues in Burkina Faso, for example, the GBV AoR colleague, who is from IRC, International Rescue Committee, also supported as part of the facilitator team. We also involved the PSCA task force from the humanitarian coordinator office to present the session on the PSCA. And also we had with us also the health cluster and the protection cluster. So it is interagency. We also involve the government representatives from ministries of health, gender, social solidarity, and humanitarian affairs, for example. The participant for Burkina Faso, we had 24 midwives and one male midwife from the National Reserve. This midwife was not yet trained on the minimum initial services package, the MISP, and the GBV in emergencies training. Well, some of them are already deployed to work in the health facilities in humanitarian regions. As you know, in Burkina Faso, we have 5 humanitarian regions. We also have 23 people, including representatives from women-led organizations, UNFPA implementing partners, and national UN volunteers, local NGOs, and international NGOs program staff too, UNFPA staff, and government experts from the gender, humanitarian, and social ministries as part of the GBV specialists in emergencies, RUSA. So the country office is responsible to select participants based on some predefined criteria. So we discuss first with the country office some criteria according to the context, and then they select participants. Some countries, like in Côte d'Ivoire, for example, they had published the interest to apply to become part of the RUSA, and external people also applied. For Burkina Faso, and I think to be the case in Togo, they had selected people in the country according of the expertise and also the national capacity which already exists in the country. The objectives of this training is first to strengthen participants' technical knowledge in the respective fields. That means midwife and GBV specialist. Focusing on the minimum initial services package for midwives and the GBV minimum standard in emergency for GBV specialists. is a package, the training package is constituted of around 17 sessions. Yes, 17 sessions for GBV specialists. And all the sessions or module are related to the GBV in emergency minimum standard. We also add some other essential topics. The second objective is to build practical skills for providing integrated services through joint sessions on clinical management of REP, the CMR, and also the psychological first aid, also the PSCA. We also discuss good practices, the standard, international standard, the minimum standard, and also we hear from them the great approaches and best practices for high quality service delivery in GBV and SRH emergencies. This is also an opportunity to promote this training, also the opportunity to promote the collaboration and clear referral pathways between SRH in emergency and GBV in emergency actors at national level. So, as I've said, we also provide them with some information or skills about humanitarian principles. If they be deployed in humanitarian areas, they need to know what are the humanitarian principles, and OCHA supports us in doing that. We also discuss and present to them humanitarian architecture at global and national level, including the humanitarian research, so they can be aware about all the change in the world, including the humanitarian architecture. We emphasize also on partnership and localization, and what are the opportunities for women-led organizations during this humanitarian research. And also we try to provide them some skills about how to well communicate on GBV in humanitarian settings. And we inform them on the technology facilitated GBV, and we provide them some skills on GBV information management and analysis, how to use GBV data to provide information, to inform decision-making, to inform the GBV situation in the humanitarian settings, and not only be focused on numbers, figures, how to analyze GBV situation, what are the tools for that. We also do exercises to that as part of methodology. We have the training take 5-day in-person training, 3 days for specialized session for each group, that means midwives or GBV specialists, and 2 days for joint sessions to strengthen collaboration and referral systems, including, for example, GBV key concepts, MSP objectives, and how, when we meet in the objective of the MSP, the GBV SRH integration approaches, how to integrate GBV within SRH in emergencies programs, and how to integrate GBV within SRH emergency program or activities within GBV in emergencies program. I've already said about communication, but also we try we emphasize on the risk mitigation according to the 2015 guidelines, interagency guidelines on risk mitigation. We give them some case studies on GBV risk in other sectors, as non-specialized sectors, and then they use the guidelines to identify what are the people at great risk, what are the risks, and which kind of measures or actions they suggest to address those risks. We give some photos on humanitarian situation, and they try to discuss and give us what are the risks and suggest a plan of GBV risk mitigation for the related sector. The training used case studies, group discussion, role plays, simulations, and at the we also do what we call the, I can say, baseline and headline for the training. For Burkina Faso, for example, we have already the result for the baseline, but we didn't already analyze the results. That's why I can't provide you the information about the findings of that. And we have a follow-up evaluation, which is planned 3 or 4 months after the training to measure the long-term learning and application. That's what I can say about the mission in Burkina Faso. Liliane, I don't know if you have something to add, and I will be happy to respond to your questions. Thank you.
Oswald. I'm sorry, I will not be able to put the video. We are working from home as with the post-electoral tensions, so the internet has been poor for the last 2 weeks. So thank you very much for this comprehensive resume. One thing I would like to add is my appreciation for this great opportunity, because as you know, this training came at the right time when there is a lot of questions and confusion, particularly on the humanitarian set. So having this training was an opportunity just to highlight what does it mean, and also how humanitarian response can continue despite whatever the structure it may take in the country. And another thing that I should highlight is investing in national capacity. It's one takeaway, particularly that I'm going to also to advocate for Cameroon, which is, as you know, in accelerated transition. So investing in a national capacity in responding in a humanitarian response is very, very key for longer term and also for ownership. Another element that Oswald has mentioned already is collaboration, having this interagency expertise approach, having different organizations presenting on different aspects, reinforce participant understanding that GBV is not only for GBV specialists or practitioners, but that there is also a great role that needs to be played by other actors. So highlighting this multi-sectoral approach was very, very interesting, and also the experience sharing. We heard a lot. There was a need, particularly for participants coming from very, very remote areas and had to reach locations. They had an opportunity just to share their challenges and also have some clarification on their questions, and also having government staff in the participants. They gained a good understanding of the key basics. For example, they understand the added value of using GBV IMS and not other types of usual monitoring tools, which can be an element that can be leveraged, for example, to do advocacy and so on. So the training was really appreciated, and I think it's gonna change. It's gonna have a great impact across the region. I know. After Burkina Faso, there will be Togo and Benin, but I'm also doing advocacy to have it in Cameroon as we are transitioning, at least to have a roster, not only in humanitarian regions, but also across all the 10 regions. Thank you very much.
Thank you, Lilian. Sounds great. Sounds very ambitious, and it sounds like it was. Yeah, I've seen Oswald train, and I know he's a good trainer. There's a question to you from Caroline in the chat. I don't know if you saw it, Oswald. It's about
Yes,
the training material, or whether it was a discussion, or did you use training material on the technological, I don't know, tech-induced GBV?
Yes. Thank you, Astrid. Thank you, Caroline. Yes, we have used the materials. We prepared some materials from the one we already have for UNFPA. So I can share the material with you. No problem for that. But I would like to highlight that this session is among the one who gains the interest of participants. So, you know, in Burkina Faso, they already have a law about to criminalize how can I call them, online, online violence, not only GBV, but online violence, including GBV. So it was like an occasion for them to evaluate, to see how GBV can, how to have a specific law on GBV online violence. And they understood very well what means TFGBV. When we talk about GBV, what does that mean? What are the consequences? We provide them some types of GBV related for technology, and who are concerned for that, and how it appear, and what are the services available, how they can build and refer GBV survivor of TFGBV to available specialized GBV services as part of the referral pathway, as you know. So I think Lilian was the one who presented that session in Burkina Faso, and I presented it in, I will present it in Togo, and I presented it in Cote d'Ivoire. We also have some materials from the SFRI forum. You know, I was there, and UNFPA, UN Women also presented something about that. And Cameroon now is doing, Lilian is a GBV coordinator in Cameroon. They are doing a researcher on GBV facilitated by technology. So we have some great news from the region about that. Thank you.
Thank you, Oswald, and thank you for the question, Caroline, because that was very interesting, actually, to hear more. And it gives, I don't know, if are there other questions to Oswald and Lilian? Because if not, it's a perfect segue to our next session. You know, we have Caroline Masboungi and Dina Hanania presenting on the prioritization paper, technology and innovation. And the TIRG co-chairs, as they are, it's the reference group within the AoR. So handing over to you both. Nice to see you.
Yeah, nice to see you as well, and thanks so much for having us. Let me get the screen share going, and we can dive right in. I was also thinking it's really a perfect segue to the topic of the prioritization paper. So glad we have the chance to kind of start building some of these linkages even more as we go along. And I hope you can all see my screen okay.
We can. We can.
Perfect. Well, great. Thanks so much. And good morning, afternoon, evening, everyone. Thank you so much for being here today and for the opportunity to share a bit more about this, relatively new paper that the Tech and Innovation Reference Group developed. To those of you I haven't met yet, my name is Dina Hanania, and I'm the Violence Against Women and Girls in Emergencies Advisor at CARE, and also the GBV AoR Technology and Innovation Reference Group co-chair, along with the amazing Caroline, who's also on the line with us today. Carol, I know you are in a workshop, but if you want to unmute briefly and introduce yourself, feel free to go ahead, and then I can kick us off.
Yeah, thanks so much. I actually escaped. I was in the same workshop than Jennifer that had calls this afternoon. So yeah, thanks so much for having us. Caroline Masboungi, and I work with UNICEF in our global gender-based violence and emergency team. I lead our portfolio on technology and innovation. So almost 2 years ago now, we had this discussion in the core member meeting of the GBV AoR about the need to coordinate more around GBV tech and innovation. That, as we heard just from Oswald, is becoming more and more prevalent in humanitarian context, both in terms of the tech violence, but also in terms of the kind of tools and tech solutions we deploy to tackle those like GBV at large, and specifically technology facilitated GBV. So since about 2 years, we've been coming together, and our group keeps growing and growing, and to discuss that intersection. So yeah, over to you, Dina.
Great, thanks so much, Carol. And yeah, on behalf of the TIRG, we're here to present you the new interagency funding prioritization paper on tech and innovation in GBV and emergencies programming. So you'll see the Tech and Innovation Reference Group, abbreviated for the TIRG for short. And Carol, started by introducing us a bit more to the group, but just to give you a bit more context around who we are and what we've been up to lately. We bring together around 167 members and growing from different organizations, including UN agencies, INGOs, local NGOs, including women-led and women's rights organizations, as well as, very importantly, also tech actors working at the intersections of GBV, innovation, and tech. And in the group, we've really kind of been seeking to play this key role in promoting safe, ethical, and effective use of tech in GBV programming during emergencies. So, in response to the current funding environment, our work has kind of taken a bit of a new shape, and of course is becoming increasingly urgent. But we've worked together as a group to map some collective and urgent funding priorities where GBV and technology intersect in emergencies. And that exercise really is at the core of this funding prioritization paper that we're happy to share with you today. So just starting kind of with a bit more of scene setting of why does this matter now? And as we all know, the sector as a whole is grappling with a severe and unprecedented funding crisis. You'll see some stats here on the screen, but really in response to this kind of current funding environment, the TIRG members agreed to come together and develop an interagency prioritization brief, which really maps collective urgent funding priorities at the intersections of GBV and emergencies and tech for strategic investment, particularly in safe tech to support GBV and emergencies programming. And so by aligning kind of funding with these collective priorities, different stakeholders can maximize this impact of limited resources. We can reduce some of the duplication and fragmentation that could arise, and really, and very importantly, ensure safety and consistency by promoting safe and evidence-based approaches that are grounded in the safety of women, girls, and others at risk, others who are also at risk. And so while the paper that we'll share with you today, focuses on these core priority areas for investments, I also wanted to emphasize kind of a lot of what we've been hearing in our circles, but more broadly kind of across the sector, but with a particular, I think, importance and relevance for our GBV and emergencies work. I think there's this kind of very quick and accelerated rush to trying to figure out how technology might make humanitarian work more efficient, or how we might be able to do more with less in this kind of new age that we're all in right now. And we wanted to emphasize, while we're highlighting some of these key priorities and kind of investment areas collectively, we wanted to kind of do a bit of ground setting and start from the foundation that technology should only be deployed when it's the most appropriate solution or accelerant to resolving the challenge at hand. So kind of before rushing or investing into a digital initiative, would really encourage all of us to continue to kind of critically assess and really demonstrate whether a digital solution adds value beyond and complements traditional GBV service delivery approaches, and very importantly, whether it can be implemented safely. So in this context, really underscoring kind of that the responsible use of technology to help bridge these gaps is going to be more important than ever. And we want to make sure that this is being done in such a way that is responsible and ethical. So we've kind of come up with this prioritization paper with kind of a broad audience in mind, thinking about kind of where we are now. The intended audience for this paper includes, and you'll notice this is kind of a large swath of people. It includes, but is not limited to, bilateral donors, private foundations, different funding mechanisms, humanitarian coordination bodies, and other organizations who are implementing GBV and emergencies programming. And we work together, to identify some core priorities by kind of undertaking lots of different steps that all fed into this one collective process. We came together months ago to kind of start with this collective prioritization exercise, where we were kind of lucky that we had already mapped at the TIRG level, with participation from the different members of the group, digital GBV and emergencies initiatives that support GBV response, prevention, and risk mitigation programming. And we built on that mapping that we already had, as well as kind of numerous dedicated technical discussions with the TIRG, by kind of analyzing some funding patterns and gaps, and building on all of these inputs together to validate kind of priority recommendations. So this approach overall will ensure that the priorities reflect kind of the collective expertise that we have as a group, as well as field level realities rather than the perspectives of any single organization. And as part of the process, we came up with a 6-part criteria to identify these priority areas for funding. So we looked for first solutions with interagency value, ones that benefit multiple organizations and strengthen collective action. We focused on non-duplication, so addressing gaps rather than reinventing the wheel or recreating existing tools. We also prioritized life-saving impact. So those are digital initiatives with direct connection to essential survivor-centered GBV service provision. And given the focus of the group, particularly on emergency contexts, we considered humanitarian applicability. So kind of the suitability for challenging humanitarian contexts where we know there's limited connectivity amongst many other challenges. We also assessed the funding disruption risk. We know that a lot of kind of key digital initiatives and solutions were interrupted as a result of the recent US government funding cuts. So really identifying initiatives with, great impact and value that were facing this interrupted support. And really prioritized field-driven demand. So initiatives that, were directly informed by the requests and needs from frontline humanitarian workers. So based on this criteria, we identified 5 interconnected priority areas for investment that really center the safety of women and girls in humanitarian emergencies. And for the rest of the presentation, I'll walk you through some of these priority areas. You'll be able to see it in a lot more detail in the paper itself, which we'll also share in the chat. But for each of these priorities, and I'll kick us off with the first one, you can see in the paper, how the priority is directly informed by the criteria I just shared, as well as a number of kind of sample funding priorities for investment. So priority number one is digital solutions supporting GBV service provision. We know that information management systems and digital tools that strengthen case management, referrals, and service delivery really represent a critical foundation for effective GBV response. And some of the sample funding priorities include kind of lifeline funding for interagency information management systems like Mero and GBV IMS Plus, as well as kind of ensuring that we are also continuing to prioritize and invest in virtual support and information for women and girls that's inclusive and accessible and multilingual. So this could look like virtual safe spaces, as well as digital solutions that enhance coordination amongst GBV service providers and frontline workers. So some examples of that are the GBV Pocket Guide app or digital referral pathways, such as e-referral pathways, as well as kind of thoroughly vetted and secure AI-enabled chatbots or virtual assistants that are vetted with rigorous safety protocols. So the impact here is really direct life-saving support through secure survivor-centered systems. From there, priority two kind of dives into and addresses policy and standards for safe and ethical GBV tech use. We know as technology adoption accelerates in the GBV and emergencies space, we really need robust policies and standards and safeguards to make sure that we're preventing any unintended harm. So some of the sample funding priorities here include the development and dissemination of interagency GBV and emergencies digital minimum standards, which is a mouthful, I know, and I know many of you were kind of involved in this work over the last couple of years, but this was interrupted due to the US government funding cuts. So kind of thinking about how we can prioritize this work as we go forward and calling for continued investment in it, including in feminist AI guidelines. We also know that we need training on GBV digital risk assessment methodologies, support for interagency coordination mechanisms for technology governance. So an example of that would be the TIRG itself, and more research on kind of evolving digital risks on the use of AI. So this priority is about like preventing and mitigating the risks of harm through collective standards and ethical frameworks. From there, we're back to kind of talking about tech-facilitated GBV. And it's really interesting to hear more about the work and the training that's currently ongoing in your region, Oswald, and more. But tech-facilitated GBV is, as we all know, an increasingly emerging threat in humanitarian contexts. With more connectivity, there are both opportunities and risks. But increasing risks of technology-facilitated GBV that women and girls face in humanitarian settings. And it's really important for us to kind of make sure that we're supporting frontline GBV workers or responders to address this evolving kind of threat, which is very urgently needed. So some of the sample funding priorities here, including, the developing specific guidelines and training on case management related to tech-facilitated GBV response, which we know is still missing in humanitarian contexts, and kind of more specific guidance and SOPs to make sure that we're mitigating those risks, that we're putting in the right specialized services and protocols to respond to it. And really here, the reality is that increased connectivity brings a lot more urgency to this issue, and we must be prepared to address it. And then from there, priority 4 is digital solutions supporting GBV capacity strengthening. I know many of you are engaged in kind of training and different ways of promoting learning, but we've seen more and more kind of the importance of digital capacity building efforts since COVID, but more so now, for ways that we can do training kind of with less resources and less money. And that said, we know that digital learning platforms for mobile applications and kind of virtual technical assistance systems can really significantly expand the access that people have to capacity strengthening on GBV. And so some sample funding opportunities here include the development of multilingual and contextually relevant digital GBV learning content. So an example here is the ROSA app. We need platforms that support remote mentoring and technical assistance. And we also need kind of solutions designed for low bandwidth and offline environments, knowing the places where we all work, and investments to scale existing interagency GBV capacity development initiatives. And the impact here is really increasing access to quality GBV training across diverse humanitarian contexts. And last but not least, priority 5 is digital literacy and skills building for women and girls, including online safety. And I want to emphasize that this is really the foundation for everything else. You know, without digital literacy, women and girls can't safely access or benefit from any other digital solutions that we've discussed or profiled here today. And we, you know, as the TIRG kind of collectively agreed that this is a key and urgent priority for investment, to make sure that, you know, women and girls in humanitarian settings can both, through building digital literacy, you know, mitigate protection risks and also enhance access to support, including GBV services and information. So there are some sample funding priorities here on the screen. You'll see it as well, from kind of peer education models for technology skills and online safety, as well as kind of the integration of digital safety within existing women's empowerment programs. So all that said, what are we asking for? The paper wraps up with a few key recommendations and a call to action for primarily donors and funding bodies to like take these 6 core actions forward. The first is really aligning funding strategies with these identified interagency priorities that we've put forward in this paper, and from there support multi-year funding for kind of ensuring that there's a sustainable kind of development and maintenance of these digital solutions. Third is investing in interagency initiatives that are safe, accessible, ethical, and maximize this collective impact that we're all seeking. Fourth is around kind of ensuring that any funding mechanisms accommodate the specialized nature of working on this issue, particularly using tech to support GBV and emergencies programming. You know, we know many solutions, as I was mentioning throughout the presentation, kind of have been struggling a lot with the interrupted funding, and, you know, are struggling to really keep the lights on. So we're also advocating for allocating bridge funding for these innovations and initiatives that have either been hibernated or impacted by the recent funding cuts. And then last but not least, to really engage with the TIRG where relevant and helpful, and coordinate investments to avoid duplication and ensure kind of maximum impact. And kind of by directing all of these resources towards these priorities that we've all identified together, donors can help ensure that tech can serve as a force multiplier in humanitarian work, and particularly in GBV and emergencies work, and support safer and more effective service delivery for survivors and others at risk, while also upholding our commitments to do no harm. So with that, thank you for your time and attention today. The TIRG is open to all, so if you're interested in these topics or working on these topics, we'd really welcome you to join us. Feel free to either write a note in the chat or reach out to either me and Carol if you would like to discuss any of these priorities further, or, you know, need a bit more information. And yeah, we just really look forward to working with all of you as we go forward to harness tech's potential and transform our GBV and emergencies programming in a safe way that can create a safer future for all. Carol, I'll stop here. Feel free to jump in to add anything, or we can open it up to questions. Great, Jehan, we'd love to have you with us in the TIRG, and we'll be sure to forward the calendar invites and include you in the listserv as we move forward. But we'd love to hear from you if there are any questions, thoughts. I'll also share the paper in the chat so you all have it, which dives into everything we covered in a lot more detail, without being too long, of course.
Thank you, Dina.
Just
Any questions? or Caroline, would you like to add something?
Yeah, maybe just to say, aside from this paper, which obviously we're, trying to bring to different audiences so that tech can be funded more consistently, because also we know that sometimes tech is an entry point to fund more basic programming, and that's the reality, like it's fancier, it's more attractive. So sometimes, and it's also a reflection of what's happening within UNICEF, for example. It's easier to sell tech and innovation work than to sell regular, safe spaces like women and girls safe spaces, and that's sad, but that's the reality. So it's definitely something that could be used as an entry point, and that's what we're hoping to do with this paper, is to make sure that at least there is a way to streamline and not just reinvent the wheel over and over again, especially considering how costly and potentially like risk-induced are new tech products for GBV. So yeah, happy to have you join the TIRG and to reach out to us to continue the reflection. I also did want to mention to this group that we have the TIRG meeting every 2 months, and every 2 months we try for each meeting to showcase some of the initiatives. So it could even be like trainings, like what Oswald was mentioning around TFGBV, and initiatives or new tech solutions, new resources to tackle tech violence. We're trying to showcase that to the group. So part of the meeting is dedicated to showcasing ongoing initiative, also for the goal of not duplicating. We also have a mapping of existing digital solutions and tech solutions and resources in terms of guidance and reports and research that we're trying to keep track of for the same reason. So again, really encouraging you to attend, reach out if you want to, present something on the TIRG. We'll be very happy to have you. Thanks.
Thank you, Caroline and Dina. So I'm just checking the chat again. Yeah, it's the documents, but also Dr. Makwe, Margaret Olabisi, who would like to join. You have all her information in the chat. And from my side, I think it's increasingly relevant, right? Because I was talking to Anna Stone just 2 weeks ago, and she was talking about technical violence or technology facilitated GBV in Gaza. And I know it's come out quite strongly as well in the newly released Voices assessment on GBV in different regions in Syria by UNFPA. So it's definitely coming up, both as a solution in terms of case management and the GVMS and how we do things better, but also as a threat with blackmailing and photos and linking that to humanitarian situations and SEA as well. I think in some context like Gaza, I don't have the, it's the rumors are going around Gaza, around what's happening. So yeah, thank you both. And with that, I'm gonna keep the time. Over to IRC and to Najim Burhan. Are you online?
Yes, I am.
Great. So you're going to present exactly the funding and partnerships, how to make it work for GBV services in Yemen with women's organizations. So maybe in the interest of time, I'll hand over to you directly.
All right. Thank you very much. So this is Nagwin Burhan. I'm the Women Protection and Empowerment Coordinator with IRC Yemen. And thank you very much for this opportunity to present this critical policy brief in their own words, which amplifies the direct perspectives of Yemeni women-led organizations and women rights organizations. Next. So today, as I will distill the key findings, recommendations, and how we as a sector can make funding and partnership work for those who are the true lifeline for GBV survivors in Yemen. Next. So where are we in 2025? It has been a decade of war, displacement, and economic collapse that have left 6.2 million women and girls at risk of GBV. Funding cuts in 2023 had led to the closure of 240,000 safe spaces, putting 500,000 at risk, while 840,000 were reached in 2023. This dropped to 620,000 in 2024. Unfortunately, with the USG, in 2025, the reprioritized target was set to 80,000. That's 1% of the total PIN, and it's a 90% reduction since January 2025. Access to GBV services remains severely limited, especially in rural areas and conflict-affected zones. Most health facilities lack clinical management of rape, and 90% of rural zones have no GBV services. The progress on localization initiative has been slow and largely excluded the women-led organization and women rights organization, while being the lifeline. They possess unparalleled access, community trust, and cultural agility to deliver GBV services, especially in hard-to-reach conservative areas where international actors cannot. Yet, the humanitarian system is the roadblock. Their most pressing challenge, as stated in their words in the policy, was that the challenges are not socio-cultural barriers, which they navigate with remarkable skill, but systematic gaps within our own humanitarian action. The research reveals a stark paradox. On one hand, women-led organizations are the undisputed frontline responders. They build trust with authorities, use culturally acceptable terminology, and embed GBV services within the broader programs. They are irreplaceable. However, their most significant barrier are not the mahram requirements or the community sensitivities. It is our system failure to provide equitable funding and partnership. This brief identifies three core areas where we are failing them. The first finding was out of reach. Women's organizations lack access to quality and flexible funding to deliver GBV services. Only 3% of all humanitarian funds in Yemen go directly to the local actors. Women-led organizations are extremely sidelined, forced to work through intermediaries. Lack of access to donors, including through decision-making coordination structures, affects the ability of women-led organizations to effectively communicate their impact and results in missed funding opportunities. The current funding system forces women-led organizations to operate under unrealistic requirements, reporting in English, following rigid financial procedures, rather than adapting to local contexts. It makes it nearly impossible for smaller groups to access funding. An INGO key informative noted that many funding policies are designed with Western context in mind, making them inefficient in Yemen. It begs the question, what do Yemen-specific funding model looks like? Currently, funding is short-term, overhead costs are severely underfunded, 5 to 10% versus 15 to 30% for INGOs. Security, mental health costs are excluded despite women delivering GBV services face daily threats of violence and security risk, including harassment and intimidation. This is an unsustainable model. Inaccessible processes. The call for proposals are not in Arabic, aren't shared widely, and eligible criteria, 1 million minimum budget, systematically excludes smaller community-based women-led organizations. While the overall humanitarian response for Yemen received 1.3 billion, the YHF, a key direct funding source, allocated just 36.9 million. Of that, only 12.4 million reached 11 Yemeni women-led organizations. So this trickle down, the funding is not enough. Next. I leave you with an example of an interview highlighting the needs to access key platform, particularly for smaller groups. Next. While some INGOs are making progress towards fulfilling their equitable partnership commitments, significant gap persists in roles and responsibilities in the implementation of projects. Financial management in particular remain a primary concern for INGOs and donors, and the lack of efforts to adapt requirements and expectations reinforce negative perceptions. International actors continue to place a lot of financial and operational risks on local partners responsible for delivering the projects, including GBV interventions. Risk is outsourced, it's not shared. Women-led organizations bear the burden of operational and security risk with no provision for the extra cost of their dangerous work. Some women-led organizations and INGOs respondents highlighted the challenges smaller women organizations face in being seen as worthy of partnership opportunities and funding compared to the other local NGOs, which are often male-led. This reflects to an inherent bias, which some women-led organizations believe include a gender bias towards local and international organizations, which are seen as lacking capacity and expertise to deliver projects. The partnership model is broken. Women-led organizations are treated as subcontractors for implementation, not a strategic partner. One women-led organization representative told us, "We are often brought as an implementing partner after the project is approved. By then, there is little room to adjust the design to fit the local realities." This isn't a partnership, it's a subcontracting. It perpetuates a power dynamic where international actors control the what and who, while local actors bear the risks on the ground. Next. That's another example from one of the interviewees in the brief. The third finding is that even our localization efforts are gender blind. They fail to specifically address the exclusion of diverse women-led organizations. While some national NGOs, including a small number of well-established women-led organizations, have access to actively engage in the localization agenda, within the humanitarian coordination response, they're not leveraging their position to advocate for greater prioritization of women organizations in all their diversity, including smaller and informal ones. This limitation was acknowledged by some national actors themselves. We have also to be aware that an increasing competitive funding environment can prevent smaller informal women-led organizations from growing, without efforts to prioritize this. Despite the recognition among both international and national organizations that localizing localization is a critical step towards ensuring the delivery of essential services to the most needed, including women and girls, the NGO Forum and the Yemeni Women-led network that was established with the support of NIR are positive steps to integrate, but much more is needed. Another example from a key informant was shared also. And then where do we go from here? Next. Yeah, next. So we have identified 5 key areas where INGOs, donors, and national organizations can make a real difference. The first one was shifting the power. So donors and international NGOs must embed women's organization in coordination and decision-making structure. Localization is not about numbers. It's about who leads and who decides. The second one was reform funding systems. Call for proposals must be transparent, inclusive, and accessible to grassroots groups. Budgets must account for core needs like rent, security, and staff salaries, not just direct project cost. We need to invest in their capacity, so support should reflect women's organizations' self-identified priorities, not external metrics. Larger, well-established national groups should be resourced to mentor and elevate emerging organizations. Foster peer collaboration was the fourth one, where communities of practice can provide cost-effective platform for knowledge sharing, innovation, and solidarity, helping to sustain women-led responses as INGOs scale down. The fifth one was strengthening advocacy. So women's organizations must be recognized not only as service providers, but as leaders. Their perspective must shape policies, programs, and reforms. Thank you, everyone. So in conclusion, this brief is not just a report. The words of Yemeni women leaders are clear. They're not asking for permission to lead. They're already leading. They're asking us to stop being the bottleneck. The time for the incremental change is over. As humanitarian funding cuts cause more safe spaces to close, our failure to act has direct life-altering consequences on the women and girls that we serve. Thank you, everyone. And if there is questions, I'm here.
Thank you so much, Nagwin. It was a very good report. I think what's disheartening is that I think we kind of know some of the issues and we are not moving in a way. It's not, the system is not moving fast enough. I know under the call to action roadmap with all the global donors are part, it's been a big advocacy issue that we're all talking about for 8 years. But thank you for bringing the call. We need to continue for sure. And maybe there are questions as well. I see there is Patty, there is Lina and Mercy on the line as well from IRC. And I don't know if other colleagues would like to say something from Yemen, but thank you so much for the report. And maybe there are questions. Let me check the chat. They're all still on the... Lots of thank yous. We do need to be encouraged to do better. I think it's starting to become a question of, how can we continue unless after a while we manage to make the changes we are advocating for. It really speaks to everyone and how we move forward. And at least in the humanitarian reset, we've also seen, and I see Jeanne is online as well from CAFI. I mean, clearly within the last months, the women-led organizations and the CAFI have been the super vocal in terms of meeting with ECOSOC, talking to HCs, talking to the ERC, and really saying and demanding to be part of the leadership. You're right, the leadership is there. It's not, but there needs to be space at the table, and we need to continue to demand. And I think in the humanitarian reset, we promised we were not going to talk about the humanitarian reset, but I think it's also true. Like the ERC sent a message out, Tom Fletcher, to all the principles and kind of the humanitarian system, right? That women-led organizations need to access increasingly pooled fund, need to be part of advising HCs, need to co-lead coordination. And also within the consolidated protection cluster that we're transitioning to, there is recognition in the guidance from UNHCR, UNFPA, and UNICEF that structures need to adapt to the needs and the agency of local actors, and where local actors would like to lead or have working groups, our systems should adapt to that need. It's probably not enough, Nagwin, but there is a momentum at some levels, and then of course the funding also needs to follow, because in the end, everyone needs money to do what they want to do and to take the leadership. Any other questions or comments or? No, if not, a huge thank you. Then
I raised my hand.
Yes, Jeanne, come on.
Yeah, thank you so much for the colleagues, both Dina and Nagwin were perfect, amazing. And thank you, Astrid, for highlighting the issue of the CAFI and what the CAFI network is really is doing and was doing during all this consultation. I think now, for me, what it should be done is really to advocate with donors, because Tom Fletcher was saying as well that it is a donor-driven issue. So it's very important, if we want really to increase funding, to go directly to women-led organization and to have more funds going to women-led organization. It is, I think, now the work that we have to do with donors. This is very important because we are doing our homework, all of us. Each one of us is doing a very good homework, but now we have to hold them accountable to what it is said. And especially if we want to take the example of the Grand Bargain, 10 years after this, we are still underfunded, knowing that the commitment was 26% to go to local organization. So we don't want that this is repeated now with this new phase. And the other thing that I would like as well to emphasize is the pool funding. I'm very scared with this new structure, the powerful structure that it is going on, especially if the pool fund will be channeled only through the CBPF. Because again, we are in the same vicious cycle where women-led organization and grassroots organization won't be able to access these pool funds because of the due diligence, because of a lot of barriers that will not allow grassroots and women-led organization to reach these funds. So that's why it's very important to advocate for funds, NGO fund or funds going directly only for women-led organization. And thank you so much.
Thank you, Jean. And I think from our side, and then I'll hand over to Emily Page, we have a consultation. There are annual consultations between the UN agency, OCHA, and different UN agencies every year. We have our strategic consultations focused on SURF and pooled funding this week. And the whole access to local actors of pooled funding is, of course, a big part of that. Because I agree with you, the ERC has gone out very clearly about he would be open to having increased funding to women-led organizations, local actors within the pooled funding at country level. But he's also, in the meeting we were in together with the call to action and the core members, he's also then kind of throwing the ball back at the donors saying, if that is to happen, you need to prioritize and tell me. So you're right. It's the member states at some point that also have to change. Emily, UNHCR? Emily Page?
Thanks, Astrid, and thanks a lot, Nagwin. It was a very interesting presentation. I was just wondering if there were also examples from Yemen or maybe from other local women-led organization on the call on like more specific kind of good practices that they've seen, from donors that they've worked with, because I think obviously I take on all the key points. I think we all agree on them that were shared, but that's more at the higher level. I was wondering if there is anything, I don't know, a particular donor, and would be a UN agency or other INGO has put in place that you felt were powerful and that we could maybe all learn from, or I don't know if you have any other ideas of something that hasn't been yet done, but you feel could be helpful. Thank you.
And Emily is also the co-chair, so part of the steering committee of the call to action. So I don't know, open the floor. I don't know, Jean, is that a new or an old hand?
Yes, it's a new.
Okay.
Yeah. Thank you. If you want to talk about the Lebanese context, I think that there was a lot of work with the resident coordinator in Lebanon and with the protection sector. And I think that GBV is still a priority in Lebanon. And under the protection, we have now the sector which is protection, child protection, and GBV. So all the strategy, everything is done with these three component together. So I think it is a very good point that we reach out in Lebanon. And I think this is because of the very hard work that women-led organization and local organization we are doing to be engaged more and more with the HCT. Since we secured one seat for women-led organization at the HCT as well in Lebanon, the humanitarian coordination team, and at the advisory board of the CBPF, which is, I think, something very good, and we are trying as much as possible to influence and to be engaged in this. So I think it's a good lesson learned for other contexts, maybe, to really be very close with the representative of the country and with the UN bodies, Yeah, thank you.
Thank you. I mean, it is very clear that it's true that in our dialogue with OCHA as well, that they're saying the HCs are expected to engage more or have these advisory bodies that include women-led organizations to help prioritize GBV. I don't know. Are there others who would like to come in? Maybe from our side, we've also done, Anna has also done a survey on with more than 200 women-led organizations and local actors in the Arab states about the issues around access to pooled funds. So we're also going to use that for our dialogue with OCHA. But we have Mekwe, you put on your camera, so I think that's a sign you'd like to speak, and you hand your hands up. So over to you.
Okay, hello everyone, and good afternoon, good evening from Nigeria. My name is Mekwe Olabisi, and I want to share a unique experience that we had in Nigeria. We have an organization called Women Advocates Research and Documentation Center. They had grants from USAID in 2022. So what they did was to make women-led organizations that are at the grassroots, sub-grantees. They empowered us to go into the community to set up community response teams within the community that will take up issues of women who are violated, women who are going through gender-based violence. And it has been a unique experience because, you know, it gave us opportunity for those of us who can speak the language, who have the culture of the people, to be able to speak up for the people. So it was an opportunity for people who were having problems to talk to those community response teams directly because they understand the culture of the people. So they report the issues to us, and we now report it to C. So it was a very good experience for us because it added value. Another thing that we did was to talk to the women chiefs. You know, in Nigeria, in the African context, the cultural barrier is that the men are the chiefs in the palace. So we have only one woman who is like a representative of the women within the community. So we engaged the women chiefs, and we use them also to do the work of GBV within the community. So it is a very good experience sharing, and it is something that is well emulated. Concerning the funds that is drying up, what we did was to look inwards, the funds are no longer coming, but we look inwards and we're able to mobilize funds to do our work. But it can never be like the funding that we get from the global perspective. So it's good for me to be here today. This is my first time of attending your meetings, and I look forward to attending more. Congratulations to all the presenters for all the good work that we are doing. It is worth emulating. Well done, everyone. Thank you for this opportunity.
And well done to you for all the engagement of civil society in Nigeria. I know there's a huge network of civil society and women-led organizations. And Christine Apio, who's in our team, and now the UNFPA lead, she spent a lot of time in Nigeria during the call to action roadmap. And I remember the whole force of the women's movement saying what they wanted and how, setting their priorities was very, very strong. It was impressive. So well done to you too. I think with this, I'm looking at time. I think I'm going to hand over to Shiva on the 16 days campaign and the protection forum. So Jennifer has, I think, already shared with you the email with the program of the protection forum, which is open to everyone. From our side, we are busy with the protection cluster, organizing for next week a protection conference with 3 sessions for coordinators, including a session addressing questions around the future of coordination. And then the week after, you have the protection forum that Shiva will talk to you about, as well as the 16 days. Shiva?
Thank you, Astrid, and
Thanks.
hi,
Over to
everyone.
you.
Thank you so much. I have put the link for the GPC forum in the chat. I mean, the registration, they opened the registration for each session yesterday, and you can go through it and register for the sessions that you want. The first 2 sessions, just to give an overview, they are about the global trends on protection, and the other one about advancing the protection in the prioritized context. The third one is about protection and technology that we also talked about a lot about it today. So in case you're interested to hear more also from other sectors, feel free to attend that one. Session 4 is about food security and protection sectors and how they collaborate, working together. And session 5 is accountability to the affected population at the forefront of decision making. And the last one is justice as protection. The panels, from what I know, I'm having a call to confirm this in a couple of hours. They're not finalized for all of them. Otherwise, I would have told you like who are the partners from GBV AoR side that they're going to be on each panel. But we can also share those information later with the agenda again as a reminder in case you're interested. And for the 16 days of activism, I have shared the concept note with many of you already. And as you might have seen, we are focusing this year on the backlash or pushback, as you might want to say, against GBV and gender sectors. And this is considering the extent and amount of changes that we are seeing this year. And we decided to focus on this backlash on GBV language and programming, and specifically in humanitarian response, and which is something that we have all been witnessing more and more this year, especially this year, and partly is defunding, of course, that we also talked about today, but also partly on the policy level, the pushback that it's also like against gender language, gender programming or GBV programming on the policy level, and as we all know, it also had a greater impact on women-led organization. So we are choosing this theme this year, first to acknowledge that we are all going through this backlash and what different organizations and women-led organizations are going through. And second, to highlight the impact that this rollback on women and girls and delivery of GBV services can have on different levels, and advocate for the continuity and investment for GBV service provision and safeguarding the space for GBV specialized services, and again also amplify the voices of women-led organizations. On the global level, we still under discussion, but we might have a joint statement that we will also share around for signature with other women-led organizations, other members and partners. And we will also have a panel that we are still discussing with community of practice and other members to see like the level of panel to also go through this backlash and the ways that each organizations are also trying to adapt to this situation. And we have also asked our members and partners to share the activities that they have, they are organizing for 16 days with us, and not just for 16 days. Like, we also like chose this theme because it's also easy to be included or be reframed to adapt to different themes that organizations and country teams might have. For example, even the resources that we had today from technology and innovation, and also the funding for women-led organizations in Yemen, there are also the ways that each organization are either adapting or trying to focus on how we invest more on women-led organization, considering these limitations. So these are also the things that we will all collect and share them with everyone during the 16 days of activism. And that's it. In case you would like to hear more about 16 days, or you would like to share something, please feel free to send me an email. I will write my email again in the chat. Thank you.
Thank you, Shiva. Anyone would like to share on the 16 days? I know in our team we've been thinking with Jennifer and Shiva, like how to do a big attention on the 16 days, but also knowing that a lot of us are very busy, and there are also colleagues across organizations who are not necessarily continuing into next year, and there's the humanitarian reset, and there's a lot. So we also don't want to push everyone too much, but we would love to be able to have a coordinated effort. So please look at the concept note. I mean, the big idea is to try to pull it together and to magnify everyone's voices and try to build off each other. I think that's the main. I don't know if there's any questions or inputs. Or by email, reach out to us by email, share your plans. And maybe just before we leave, I shared with the core members, but not everyone is core members here. I also want to say that Anna is on the bus. She's to Gaza. She has confirmed she is on the list of those who should be given access and enter for another 2-week mission. It's always a bit nerve-wracking, also because the confirmation of who's actually able to enter is, last minute and not so clear. But look at the concept note for the 16 days. Join the sessions you'd like, 1 or 2, 3 on the conference, on the Protection Forum, and reach out to us whenever you'd like. And we'll continue. I'm looking at the time. But again, I don't know if there are hands that I'm not seeing around the 16 days, around, it makes me think, the report presented today, for example, would go very easily into the topic of pushing back on the pushback or pushing forward on the pushback, Nagwin. So I don't know if there's something we can do with IRC colleagues to also amplify the report. Otherwise,
I know that we're at time, but I just wanted to say, and I shared with Shiva before, hi everyone, this is Lena Minshew with the IRC. We are supportive of this kind of general process for 16 days and the idea of the campaign. I do want to recognize, especially given our friends on the call who presented on TFGBV, that seems to be the overarching frame for the global Unite. Yeah. So just wanted to make sure that we're aware of that, and of course that we can incorporate some aspects of the work that folks are doing on TFGBV in this campaign.
Absolutely.
But we definitely think that given where we are right now in terms of the funding landscape, et cetera, that it makes a lot of sense to really center that within our messaging. So thanks for taking the lead, and we look forward to inputting. Thanks.
Thanks, Lena. Okay. let's we go out with that positive voice from Lina. Okay, thank you everyone. And again, you can reach out to us. We can have bilaterals. We're very happy to hear from you. And yeah, let's stay in close contact. Thanks. Bye.
Thanks, everyone.
Bye.
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 Bye.